How can someone tell if therapy is working?
There are several different ways that someone could tell if therapy is working. One of the most important factors in successful outcomes of therapy is the client-therapist relationship. And so research has shown that within 2 to 3 sessions, the client should get a sense of whether the therapist is right for them. So they should be looking at, how is the relationship? Do I feel comfortable with the therapist? Do I feel that they're getting me? Do I feel that I'm being heard? Am I being validated? And it shouldn't be blank validation. If someone's doing something that's self-destructive or is harmful to others, I would hope the therapist wouldn't validate those actions. But is the therapist validating the person? They can say, you know what, that might not be the best way to do things, but they're giving the client the sense that you are still valid as a person. You still have worth as a person. So if the client is feeling that, chances are there is progress being made in therapy. They may not be able to quantify it, but they get that sense that it's not so much what's happening in therapy, it's more what's happening outside. If they have a good relationship with a therapist, that will often translate into how they're functioning outside. They might be able to relate to people better. Somebody who's overly aggressive might learn to be a bit calmer. Somebody who feels that they don't have a voice, that they're not allowed to say anything, they feel guilty every time they speak up. With their therapist, they may have found that voice, and they may feel then with other people they have the right to speak up as well. So it's hard to quantify, although there is research being done constantly to see where does change occur, how does it occur, and so on. And in fact, again, the client might not recognize this, therapists often do, but clients may as well. One of the important things is that Carl Rogers years ago showed that one of the best indicators that therapy is working is that the client's ideal self, the person that they want to be, the person that they've been told directly or indirectly that they should be, and their actual self, who they really are. When those two start to come closer together, that is when therapy is really effective. And interestingly, most people think, oh, so you just elevate your actual self to this ideal person you want to be. That's not true. In most cases, it's more about having realistic expectations, realizing that the kinds of goals or ideals you have set for yourself may have been unrealistic. Being a perfectionist is not healthy. Having high standards, trying to be the best that you can be, that's healthy. But if you have expectations that you have to be perfect, well, you're never going to satisfy them because nobody is perfect. So reducing them a bit, taking out all the should, I have to do this, I have to do that, taking that out of your vocabulary, learning to have more compassion for yourself, learning to be more tolerant for yourself while still pushing yourself to be the best that you can be realistically, having realistic expectations about yourself, about the people around you. These are all indicators of successful therapy. So you might not notice them like, noticing weight loss, okay, or cutting down on cigarettes, but people will often get this kind of sense that, life is getting a bit easier, it's getting smoother, I feel like I'm functioning better. It doesn't mean that the world has changed, I have changed within the world.